Hey there, this is Carrie Clark with SpeechAndLanguageKids.com. Today I'm going to be showing you 9 different ways to do push-in therapy, also known as co-teaching. Now I've designed these methods based on what works for speech pathologists, speech therapists, but if you are a special educator, an occupational therapist, or physical therapist, any other professional that works in the classroom, these methods will work for you as well. So let's jump in and look at those 9 different methods. Okay, so let's jump in with the 9 different ways to do push-in therapy or co-teaching. The first one would be a therapist-led lesson. So in this example, the therapist will plan a lesson to give to the entire class, and they will teach something that will benefit those in the class, the whole class, but including the child with special needs or the child that's on an IEP. So a good example of this would be social skills. The therapist teaches a lesson about social skills, and then everybody is able to benefit from that lesson along with the student who is struggling with that skill. Another idea for therapist-led lessons would be to demonstrate a language or teaching strategy for the teacher to use with the whole class later. So if there's a strategy that you know works particularly well for the kiddo who is on an IEP, you can do a lesson that demonstrates how to use that strategy so that the teacher can watch that. During the therapist-led lesson, the teacher will be assisting with other students who need help during the lesson. So if you have a kiddo who has some behaviors that need to be taken care of, the teacher would be helping out with that and also be watching the examples set by the therapist for the type of instruction that is being used. So that is the first model, therapist-led lessons. The second model that we're going to look at is co-teaching with co-planning. So in this example, the therapist and the teacher are going to plan their lesson together and choose appropriate targets for the students. The therapist will suggest specific language or teaching strategies that will benefit the students on the IEP. So if the teacher is saying, hey, let's work on, let's say, water cycle, then the therapist will say, oh, you know, my kiddos are really having trouble with vocabulary. So how about if we work these vocabulary strategies into your lesson on the water cycle? Similarly, if you are an occupational therapist, maybe it would be talking about which fine motor tasks would make this easier for the students during the activity. So then the teacher is going to teach the lesson, and the therapist will be nearby, adding or elaborating as necessary, just any additional information that can be thrown out there. And then after the lesson is given, the class breaks up into groups, and the IEP students are in the half with the therapist, and the therapist and the teacher will help the students practice and master the new skills. So this allows the therapist to kind of take a gauge on whether or not the students with IEPs were able to learn from the lesson, or if they still need a little bit of extra teaching, and then use specific strategies that work for those students. So that would be co-teaching with co-planning. The third model we want to look at is the therapist taking a center or a station. This works particularly well with the lower grades like kindergarten, preschool, where there are maybe like a literacy stations where everybody goes around and does a different literacy activity around the stations. So while the whole class is doing their centers or rotating through the stations, the therapist will be set up at one station. So the therapist does an activity at her station that has to do with the IEP students' goals, but incorporates the non-IEP students as well. So maybe she has a file folder game laid out with some pronoun work on it, and the IEP students would be divided into amongst the different groups. And whenever that child got to the group or to the station with the therapist, and the therapist would work on the language activity, the pronoun activity, and work on that with the IEP student, but also with all of the other students. And the benefit of this is that that IEP student gets to practice the target skill in the regular education setting with his peers. So this is going to be a less restrictive way to work on that skill. All right, number 4, the fourth model is going to be the therapist leading a routine activity. So the therapist is going to take control of the classroom for one activity that's part of their normal day, such as snack time, group time, circle time. I used this one a lot when I was working in early childhood special education. So I would take maybe circle time and lead the circle time, and that would count as minutes for all of my kiddos in that classroom that had IEPs. So the therapist will lead the activity just as the regular teacher would, but would use additional strategies and instruction methods that are helpful to the IEP students. So maybe they are doing a book reading at circle time, and the therapist models varying the levels of questions that are asked to the students based on each student's individual level, or maybe modeling some think aloud strategies that are good for story reading. So the therapist targets the goals of the IEP students and models the teaching strategies to the teacher. So during this, the teacher will be assisting with students as needed, such as behaviors, but also watching and listening for those strategies that she can then later use in that routine activity the next time she does it. The fifth model that I want to talk about is therapist leads a unique activity. So the last one was a routine activity. Now we're going to talk about using a unique activity. So the therapist is going to design a new activity that's built into the student's day. And this new activity could become part of the daily routine. It doesn't necessarily have to, but it should enhance some part of their education while still working on IEP goals. So this may be an enrichment time where a new skill is practiced outside of the typical instruction time, or it could be a getting ready to learn activity that will put the children in the right mindset for to benefit more fully from the upcoming lesson. So the picture here that I have would be a sensory motor activity, and this is one that we did when I was over at the schools in the early childhood special education classrooms. Is at the beginning of each day, the therapist would come in and we'd set up a little obstacle course along the room. It just had to have a couple objects in it. It wasn't anything too fancy. And sometimes one of the obstacles would just be a circle on the ground like you can see there, and the kids just had to step through them or jump through them. And I typically worked with the physical and occupational therapists because they would be able to incorporate their motor goals for the children. But then I would work during this little obstacle course activity. I would work on following directions because I would tell them what to do and then have them follow through and remember what was said. And then we would use some vocabulary words such as jumping and running and skipping and hopping and all of those good action words. And then we'd do vocabulary with the objects that were on the floor, the circles, the shapes, the colors. So we worked vocabulary, we worked on following directions. And the overall outcome of this was not only did we have a really fun time to work on IEP goals, but it also got all of the students in a good mindset to learn because they had gotten their wiggles out, they had their sensory motor activity, and they were much better able to sit down and focus when it came to, I think circle time was what they usually did right after that. So using some sort of a unique, not part of the daily routine activity, but something that you can do with the whole class that will target multiple speech goals or whatever other goals you are working on. All right, number 6 would be where the therapist adapts the materials and supplements the instruction. So this is less of a push-in approach and more of a co-teaching approach. So this is going to be where the teacher plans her lessons as normal and gives the materials to the therapist in advance. And the therapist is going to adapt those materials to suit the children with IEP's needs. So that maybe that's adding visuals to it, simplifying text, anything like that. And then the therapist is going to pre-teach the skills before the lesson occurs in the classroom. And then after that lesson occurs in the classroom, the therapist will review the materials with the children, provide the children with additional instruction if they need it, and additional time to practice. Now this doesn't have to be right in a row, so it's not like you do it, they go learn the lesson, and then they come right back. It could be your last session before that lesson occurs, and then your next session after. So there can be some space in there. But this would be, let's say that the teacher is working on the water cycle. So she gives you the lesson for the water cycle, and you see that there are 10 really important vocabulary words that those children are going to need to learn for their test. So you pull those words out, you make some flashcards with visuals, and you have illustrations of what each of those words demonstrates, and you teach those words to the children before their lesson. Then they go have their lesson, and the next time you see them, you ask them about those words, you give them a little quiz to see if they remember any of them, and if they don't, then you go back and you teach those additional words again, and you give them time to practice until they have mastered those. So those would be a great way to work on adapting materials and supplementing the instruction. Okay, number 7 is going to be that the therapy assists with a routine activity. So the last time we were talking about the therapist leading the routine activity. Now we're going to talk about the therapist just being there to assist one or more children. So the teacher is going to lead that routine activity as normal, and the therapist is going to sit behind one or more students to assist as needed. So you may have to arrange the students so that they are in a row or next to each other, so that if you have more than one student to work with. Then the therapist is going to help the students demonstrate skills from their IEP goals by providing necessary supports and fading those supports when possible. And then the therapist is going to use this time to demonstrate strategies to the teachers or the aides in the classroom. So if you're working with aides, this is a really good time to be like, okay, I want you to just sit back and watch what I do, because this is what I want you to do when I'm not here. So a good example of this would be working with some kiddos at circle time or story time, where you are sitting behind them and waiting for opportunities for them to either follow directions or answer questions or raise their hand and participate, and you are providing those supports as necessary. So you're giving them reminders, you're giving them physical prompts, whatever it is that that child needs. Or let's say you sit behind a couple kids during snack time or lunchtime, and when they need more food, you are giving them prompts to use their words or their communication device. So this would be assisting in that routine activity. This would be something that it's possible to just go in and wait for those opportunities to arise. You don't necessarily have to plan it out ahead of time. But if you are working on something that may not come up very often, you may have to plan a few opportunities. For example, if you really want to see the child using pronouns in the classroom, you may have to prompt that teacher ahead of time to ask a question where the answer would include a pronoun. Okay, so that would be assisting with a routine activity, and we also have assisting with a unique activity. So this would be something that's non-routine, like a specials class or a field trip. And the same thing is going to happen. The therapist is going to assist one or more students and help them demonstrate those skills from the IEP goals by providing necessary supports and fading those supports when possible. So this allows the therapist to work on generalizing learned skills to new settings, like following directions or using complete sentences. And you don't need a lesson plan for this, because this is probably going to be an activity that you're not going to be able to predict what's going to happen. You're just going to offer support when there's an opportunity for a skill. Okay, so a good example of this would be using going along on a field trip. Let's say that the class is going on a field trip and you have 2 kiddos in that classroom that are on your caseload. So you volunteer to be an adult support on that field trip, which the teacher will love, by the way. And you say, okay, these 2 kids are mine. I'm going to take responsibility for them on the field trip, and you always have them by your side. And then whenever an opportunity arises to work on a skill that they have learned or that they are learning, such as answering questions or asking questions, following directions, anything like that, then you're there to provide them the supports that they need to remember to do that and to generalize those skills. So this is a really good way to work on some generalization, especially if you have a kiddo who mostly all you do is pull out therapy in your speech room. This gives you an opportunity to get some really good push-in minutes done in a fun environment that they will be enjoying because they're on a field trip. So there's number 8, and we're finally on to our last model for push-in therapy, which is the Pullaside therapy in the classroom. So this is where the therapist is going to come into the classroom and do therapy with 1 or more children within the room. Now the children are going to be pulled to the side to a quieter part of the room, so it's a lot like the kind of therapy that you're doing when you're doing pull-out therapy in your speech room or in your therapy room, but it's going to allow you to work on those skills in a more natural environment. You can also pull some peers in so that you have some peers to work with, peers being typically developing children or children who are not on IEPs. And this is going to serve as a nice transition between doing the skill in the therapy room and doing the skill in the classroom. So maybe you have a kiddo who is working on learning to use his words when he wants something instead of taking toys away. So you get a peer and you say, okay, this is what we're going to do. And when he does this, I want you to do this. When he does this, I want you to do this. You kind of give him a heads up. And then you pull your student along with the peer over to the corner of the room, and you give the peer all of the toys. Let's say it's all the blocks. And you just wait for your child to try to take the blocks. And when that child does, then you prompt with, hey, you can use your words. What could you say to Sarah so that you can get her blocks? And then you have your child use his words to ask, and Sarah knows that as soon as he asks, she gives him some blocks. So that would be a good example of some pull-aside therapy. All right, there you have it. What I recommend is that you download my handout, which has all 9 of these models, including some examples, and you share this with your team. Share this with the educators you work with, the therapists you work with, and say, hey, which of these models do you think would work best for us? Have everybody circle their favorites and then come together at a meeting and talk about what everybody circled and figure out which models will be ones that you can all agree on, that you can all do within your classroom. And I promise that your team will work more smoothly with the push-in and co-teaching therapies. And you can get that handout by going to speechandlanguagekids.com/push-in. And when you get that handout, it will look like this. It will have each of the different models along with an example, and there are 3 pages of that. Thanks so much for watching. If you have any questions, you can leave those on the blog website as a comment, and I will get back to those at speechandlanguagekids.com/push-in. No spaces, no dashes. Thanks so much for watching, and have a fantastic day.